I actually didn't have this in mind to give a talk on this presentation in clinical conversational Spanish, but knowing or most of the conference was technology based, and so we thought it was a little fitting to the occasion. So what happened was that I'm glad that in the audience we have the co-author to this course. Her name is Mary Donna Piazza. This course was actually funded through a proposal that we submitted to the dean's office, and in collaboration with the Academic Technology Center, we were able to design this online course. And like I mentioned, the co-author is in the audience, Mary Donna Piazza, and we cannot not go without mentioning her assistant, Kirk Ford, which is a multimedia developer that also helped enormously in building this course. So this is my very first time working in designing a course, and it was a learning process. I learned throughout developing it. So just like I'm learning today a lot on technology, I learned a lot using, what was it, that Dreamweaver. I'd never heard of the program until I started working on it. We worked on developing this course for a year and a half, and it was pretty much very fun. It was like Dr. Sharma meeting with Dr. Goodwin once a week, for sure. I had to go and meet with Mary Donna Piazza every week for at least an hour or two. Sometimes it went over 2 hours. And later on, we were almost living there. I almost had an office there, so it was pretty neat. And we built a really nice friendship, actually, and so she's now a dear friend of mine as well. But it did take a year and a half to build this course. So what I'm going to do today, because it's technology, the course is technology fitting, I'm going to give you an overview of this online course, and I'm going to give you a little bit of the technology, but I stole those thoughts or those notes from Mary Donna's presentation, but I'm going to base my presentation on content. So what is the clinical aspect? So there's actually a history or a background need for this course. We looked at the fact that Spanish is the second most spoken language in the U.S., and that Texas is comprised of 38% Hispanics. This percent is going up 1 to 2% on a yearly basis. And so as of now, the Galveston Hispanic population is at 31%. And we predict, or not we, because I can't include myself, I'm not a predictor, but state demographers that do statistical predictions predict that by the year 2040, 81% of the population growth in Texas will be Hispanic. So there was a very very high justification to having built this program. The fact that there is a growing population and that is Spanish speaking, student demand, students throughout the University of Texas Medical Branch campus have been asking for a product like this. Also because of the lack of teaching Spanish speaking faculty to teach medical students. So that was also the other justification in building this online course. And also JCAHO. JCAHO, Commission on Accreditation of Health Organizations, came up with a standard that all treating clinicians must have some type of certification in Spanish. And so we're looking to helping, at least through the building of our future physicians, providing them this instructional course. The purpose. Well, the purpose of designing this course was we wanted it to be multidisciplinary. that met the need of the university, the students, and the population. Multidisciplinary in the fact that not only physicians could use it, but also physician's assistants or nurse practitioners, pretty much anyone that saw patients. We also wanted to communicate, we wanted the online course to be able to provide that sense of the student to be able to communicate with their patient population by making personal and professional connections to the patient and the family, make it not have a little human twist to it, not so much technical. The design, so the design was multidisciplinary, so it will be useful across all disciplines. The foundation was, we wanted it to stay clinical, and the approach was learner-centered, which meant that the students actively self-managed their time learning, and it would be available to them 24/7, which meant that it was going to be a standalone course, and that it was going to be modular, which meant that it allowed flexibility for the student to start at any point in time, and all students would be provided a tutor. So this is pretty much an overview of the course. We have two main components, which is the Learning Resource Center where Mary Donna Piazza focused her efforts mostly on, well, she focused her efforts on everything, but this is her baby, the Learner Resource Center, where she developed the basic Spanish, basic grammar, healthcare terminology, anatomy, the culture and online tools, have these resources available to the student at a flexible modular component where the student can actually start anywhere from starting at the culture, can start at basic Spanish basics, and each component also has a post-quiz. Later on, I will explain that it's flexible, but because I have a very high number of students enrolled as of now, I had to make it a little bit stringent or more guided towards the ones that are beginners in Spanish or not too advanced. And so we make them actually start from Learning Resource Center and start from basic grammar and work themselves through. And they have to go first module before they get to the second module and so forth. So the beginners actually have to go through the course in order. So I am going to provide you a little overview of the meet and greet. I don't have a photocopy. It's actually available through Blackboard, and available to the students and the faculty that are either supporting the Blackboard technology, or that are the directors, or that are tutors. So I don't have a picture of the course per se, but I did bring with me some videos, and this is one of them. So I want to show you what a typical video of a meet and greet. This is actually just a part or a minor component actually of the entire module. The module is divided or has sections of where the student comes in at that module and will learn all of the Spanish terminology, all of the examples of how to meet and greet, and then a practice section of all the variety of sentences, a variety of ways to meet and greet, and then practice section, a practice section of I think it's quizzes, right? Mini quizzes, and then they also have this video. They have a video in each module showing or portraying a meet and greet scenario. And then after that, after the video, we test them in all of the content of that module. So let me start with this meet and greet video. días. Yo soy la doctora Juana López. Yo soy especialista en medicina familiar. ¿Es usted don Marco?
Sí,
¿Me permite llamarlo don Marco?
sí, puede llamarme don Marco o Marco, como usted guste.
Muy bien. ¿De dónde es don Marco?
De México.
¿Prefiere que hablemos en español?
Sí, prefiero hablar en español, pues mi inglés no es muy bueno.
Muy bien, hablaremos en español. Discúlpeme si tengo errores gramaticales, pero espero que me pueda entender. Si no me puedo expresar o usted no me puede entender, le llamaremos a un intérprete del hospital.
Claro que sí.
Ahora me gustaría confirmar si usted vive en el 5127, calle 8. ¿Usted aún vive allí?
Sí, doctora, aún vivo en esta casa.
Y veo que no le dio su número de teléfono a la enfermera. ¿Me lo podría dar eso también?
Mi número de teléfono es el 409-888-8888 y necesita mi número de trabajo. Allí me puede conseguir, porque casi nunca estoy en mi casa.
Muy bien. Dígame su número del trabajo. Lo pondré en su expediente por si al caso lo necesitamos. Otra pregunta. ¿Cuánto tiempo ha vivido en los Estados Unidos?
Mi número de teléfono del trabajo es el 409-333-333 y ya tengo viviendo casi 10 años en los Estados Unidos.
Muy bien, don Marco. Ahora, dígame qué lo trae a la consulta el día de hoy.
No me siento muy bien.
So that would be an example of the one video for the meet and greet section, or the module meet and greet. That's module 1. What happened here was, we actually wrote out the script. We trained this, we hired individuals as standardized patients, and we trained them, and we made the recording. We actually had a great time recording. It does take more than just this 1 to 2 minutes. It actually took like about an entire 2 days to just do this 1 to 2 minute recording. And what we do is we try to provide the student a sense of somewhat of a real scenario of how to get to that point of how do you meet and greet. Then we go throughout the process of clinical history taking, which is how do you get to the point of obtaining a chief complaint, and then from there, go to the history of present illness and so forth. And throughout that process, we do have videos for each of those sections, and at the end, we test them. We test them on their ability of, did they understand what was on the video? So they have to listen to the video. They have to have read the module content in order to pass the test at the end. They do have up to 2 tries, and if they flunked the first try, it's just a pass or fail. They do have to contact me, and they have to meet with me so we can assess if they should move on, or if they should do something else, or if we need to send them back to the Learning Resource Center in a specific area. Now, we built this course knowing that we, meaning the Hispanic Center of Excellence, has additional resources to provide the students with additional materials, and we actually we hand out free Rosetta Stone Spanish subscriptions to our medical students. So we have a backup for additional resources to help them with their Spanish language acquisitions, and this is just one additional one that we own, that is UTMB. So here, after they complete the different sections of a history taking, we also have one module that is particular to physical exam, and we provide there the phrases that are, commands, directives, things that we usually use whenever we see a patient. And we also have pictures or scenarios of how to ask a patient, please, can you have a seat, or lay down, or turn over, or things like that. After that module, we have a special populations module where we have 3 disciplines that we show, and psychiatry is one, OBGYN is another, and geriatrics is another. So I am going to, the faculty that helped actually build this, to do the recording and build this course, they're all bilingual faculty that are part of the bilingual health track, which is the track that I direct for the School of Medicine. And so here we have Dr. Ana Rodriguez. I didn't use my name for the video, but other professors, they changed their names or they use their names. So here, Dr. Ana Rodriguez, she's an OBGYN professor, and she's gonna, oh no, Ana Rodriguez is not doing, she did OBGYN. This is Dr. Maria Camacho that is sitting in as a psychiatrist, but she's not a psychiatrist.
Buenos días, señorita Lorena López. Yo soy la doctora Rodríguez, soy psiquiatra. ¿En qué la puedo ayudar?
Estoy aquí porque mi papá piensa que debo de visitarla.
Ah, muy bien, ya veo. Primeramente, ¿en qué idioma quieres y prefieres hablar?
Yo prefiero el español si no hay ningún problema con usted.
Entonces será en español. ¿Puedo entonces llamarte Lorena?
Sí, gracias.
Ok. Ahora, vamos a regresar a mi pregunta. ¿Por qué piensas que tu papá quiere que me visites?
Yo no sé. Yo me siento muy bien.
Muy bien. Ahora, me gustaría hacerte unas preguntas más. ¿Has recibido consejería antes?
No, es mi primera vez que veo a una consejera.
Bien. ¿Estás viendo algún otro tipo de médico?
No, pienso que soy muy sana. Yo solamente voy a mis visitas de mujer como cualquier otra persona de mi edad.
Lorena, ¿has tenido algunos eventos recientemente que te causen estrés?
Bueno, me gradué en la prepa con honores hace un año. Mis padres esperan que vaya a la universidad.
Felicitaciones. ¿Cómo te sientes sobre eso?
Yo no sé. Creo que estoy lista para la universidad. Yo sé que debo de ir, pero no siento el deseo de ir. Estoy confundida. Lo único que quiero hacer es dormir. Puedo dormir por días.
¿Cuántas horas al día duermes?
Bueno, yo puedo dormir todo el día.
¿Te sientes cansada cuando te levantas?
Sí, aún sigo cansada cuando despierto.
Durante los tiempos que estás en tu casa, al no querer salir, ¿te sientes triste, deprimida o ansiosa?
Bueno, no tengo las energías ni el...
Unlike the other modules where we have sections in modules, we have these special populations are in a complete clinical history for OBGYN, complete history for psychiatry, and complete for geriatrics. So what we also provide the student, and they're not available, not unless you request them, is that the transcripts. We have that written out, and they are available upon request. So this is pretty much what we evaluate the student. There's 15 modules and there's 15 tests. So we also we did beta testing on this course, and I think it lasted for 4 months. And some of the strongest feedback was to have more activity, or they wanted more participation. And obviously this is an online course, and so we had to come up with a way to get them more involved. And so what we did was we're asking now for the beginners to build a video. And because the Hispanic Center of Excellence has purchased lots of technology or equipment, we're going to be able to, this course just started this fall, but we're going to be able to provide the student with cameras or iPads or any material needed for them to use to do their videos. The videos should not go more than 4 minutes, and they are to do mock meet and greet and a mock chief complaint and history of present illness for the beginners. And the advanced, we are asking for them to do a video on a review of system of their choice, and then also a general treatment testing and follow-up section, which is another module. Everyone has to do a final video, which is a complete medical history, and that is for the beginners and advanced. And so we test them, and that takes up 20% of their grade. The final exam is a post-test at the end of the entire course, and then that totals up to 100. So that is part of the feedback that we got. We incorporated those activities, which are the video takings, video recordings, and that is going to be part of their grade now. So currently we have 56 medical students ranging from first year all the way to third year, and we also have a fourth year that is a tutor, and he's a native Spanish speaker. All tutors, even though they're native Spanish speakers, they must take the course. But we have students from first to third years taking the course. We've also provided a discussion cafe available for daily tutoring. That all tutors are hired. My tutors are hired to be in the discussion cafe at least 1 hour a day. So every day there is a tutor available at different times, and I post these times in Blackboard. Every day there is a tutor available in the discussion cafe. I also meet with them, and I didn't put it here. I meet with them on a monthly basis, and meet with them meaning the beginners it's a mandatory meeting that they have with me monthly, once a month during lunchtime for 1 hour. And then the advanced, they can come to the meetings, or it's not mandatory for them. So pretty much more than half of my 56 students are in the beginners, and the other half are in the advanced. So this online course didn't come just because we wanted to write a course. It's actually student demand, lots of student demand, that they wanted a course available from UTMB, that they would have access to it. Lots of our medical students are very proactive when it comes to what the population needs, and they volunteer in St. Vincent's clinics, in the St. Vincent's Clinic, which is a local student-run community clinic here in Galveston Island. And they also travel to Frontera de Salud, which is the valley down south of Texas. And they're very active when it comes to volunteering and wanting to see what the community needs. And so this course actually came because of them. This course is actually here because of them. Our medical students coming up to me and asking that we have something available to them that they can actually carry around or have available to them 24/7. So we are looking into making this available to them through iPads, or making it an iBook or something like that, because they feel that they can just pop it up using their iPad while they're in the clinic within these predominantly Spanish-speaking patient populations, and they can go and look for that answer or that question or that thing that they're in need of. So because of the high demand, the faculty, the leaders in the School of Medicine were also very excited to see that we had actually finished after 1.5 years writing this course. We have been invited. We actually submitted an abstract, Mary Donna Piazza and we submitted an abstract to the IOL, which is the Innovations in Online Learning, and sponsored by the UT Texas system, and it was actually held in San Antonio this year, and the abstract got accepted, and we were able to present more of the technology based, not so much the content, but we were excited about that. From there, we we have been able to share the course and is actually being implemented through the School of Physician Assistants. So Laura Lawrence is actually using it now as part of her medical Spanish training in her first-year students. And also because of the high yield turnaround, the high news on this, also the deans of the School of Medicine that direct and run the new initiative, which is the Transformation in Medical Education Initiative. They have invited me to meet with other medical Spanish educators throughout undergraduate universities, and we are working on a manuscript, and that's the title of the manuscript. And we're also working on a grant, on an RO3, actually due in a couple of days. So, so this course is actually taking its course the way we thought it was, and we still are in talks with other universities that are interested in using it. So, because everyone is in love with it, and so are we are adding an emergency medicine module. That would be our module number 7, and we are the three case scenarios that we're going to use is an elderly patient with MI. The second is a young male with a gunshot wound. And the third one is a young adolescent consumption of toxic chemical. And we're trying to cover at least all 3 genres, or 3 populations. So we anticipate to be done. That does not mean it's going to happen, but we anticipate to be done by the fall of 2013. So I think that's it. And if you have any questions, please. Yes.
First of all, I think that's an awesome course. I can imagine as a medical student, I would really have liked that. One thing I wonder that I would imagine could be helpful too is if the medical students themselves could be tutors to the advanced level, to the beginner level, or just practicing by having conversations and getting paid for it. I don't know if that's
Our medical students are the tutors.
Oh, okay,
Yes.
cool.
They're just they have to be they have to have tested at a certain grade
Okay.
point,
Cool.
and then they're the ones. Yes,
Because they're always looking for ways to make money.
Oh yeah.
Because they're poor.
Yes, we hire our medical students to tutor, and we have actually eight tutors, and they range from second year to third year, and they're the ones that are available. They have a certain number of students assigned to them, and they are their responsibility to follow them throughout the year. They only have 1 year to access the course, and so that's why we also assign the tutor. We want, even though it's an online self-paced, but they're still medical students, and they can go shift, and take and drift away from the course. And so we have a tutor that is their immediate support, and that tutor is to report to them, or at least talk to the students at least once a week. And then they have also tutor support online, which is every day as well, and then they meet with me once a month.
Yes. Are there plans to expand this to the nursing population as well?
Yes, oh, definitely. We've actually had some talks with the School of Nursing, but we haven't finalized anything. But there are, the School of Nursing knows about it. OTPT also knows about it. They're very excited about it. But PA, they didn't wait. They actually took it while we were still brushing up from the feedback from the beta testing, and so they took it as is, and they worked with what they had, and so they were very excited. And we're very happy for them as well. And they had Laura Lawrence has actually had really great response with her students with the usage of the course.